Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is July 28, 2025. This video is on two articles published in European Heart Journal. One titled ApoB containing lipoproteins, count, type, size, and risk of coronary artery disease. And the other is an accompanying editorial titled ApoB and Lp(a), core measures to assess cardiovascular risk. Apolipoprotein B count reflects total atherogenic lipoprotein particles. The study investigates whether type, size, or count of ApoB containing particles better predict coronary artery disease. The study population consisted of 207,368 UK biobank participants, mean age 56, 57% were women. Follow-up period median 13.7 years, 7,585 incident coronary artery disease cases. Exclusions, no prior coronary artery disease, diabetes, stroke, or lipid therapy. Tools used include nuclear magnetic resonance, NMR, and immunoassays. Statistical methods included Cox regression with multivariable adjustment and validation in Swedish simpler cohort. What did they find? One standard deviation increase in ApoB count. There was a 33 to 34% increase in coronary artery disease risk. Hazard ratio 1.33, p-value less than 0.001. VLDL more atherogenic per particle, but LDL dominates due to quantity. Particle size and subclass were not equivalent to additional risk post-ApoB adjustment. However, Lp(a) independently associated with coronary artery disease, hazard ratio 1.18. Key takeaways: better risk prediction, measure both ApoB count and Lp(a). Size and type of lipoproteins offer no added predictive value. ApoB should be emphasized in guidelines over traditional cholesterol. The editorial summarizes this article. It says ApoB is a superior marker of cardiovascular risk versus LDL cholesterol or non-HDL cholesterol. VLDL particles are more atherogenic per unit, but LDL particles dominate numerically. ApoB count integrates both intermediate density lipoprotein and low density lipoprotein and VLDL risk, very low density lipoprotein risk. There is no added value from subclass or size. Lp(a) adjusts independent predictive value even after adjusting for ApoB. Hazard ratio 1.18, area under the curve increased to 0.774. Routine use of ApoB plus Lp(a) will refine risk prediction and guide lipid lowering therapy, says these editorialists. This editorial underscores global applicability, especially Lp(a) targeted therapies, as Lp(a) targeted therapies advance, including small interfering RNAs and antisense oligonucleotides. What is non-HDL-C? So this is a diagram where high-density lipoprotein is at the bottom of the test tube, while low-density lipoprotein, intermediate density lipoprotein, and VLDL. So non-HDL cholesterol is the top three molecules as VLDL, IDL, and LDL. So ApoB contains most of these lipoproteins. So an indirect marker of ApoB is non-HDL cholesterol. That is total cholesterol minus HDL, which will give these three fractions. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.